Well, if you live in Michigan and you are turning 65, you have questions about Medicare or Social Security, you're in the right spot. Grab a notepad. You'll want to take some notes. Last thing, if you need to reschedule, click the link below. Once we start, don't leave or close the screen as it may restart. Occasionally, some folks have trouble getting back in. So let's get started. Hello, everyone. My name is Jim Komoroski. Like a lot of folks here in Michigan, I got a long ethnic last name. It's hard to spell. So we made it easy. Just head to jimmymedicare.com and you'll land at the M1 agency's website. And a little bit about me. I'm an RSSA certified Social Security planning specialist. Been in business over 25 years in both financial or insurance and financial services. Born in Mount Clemens. I live near the Detroit Zoo, and I'm proud to say that I am Michigan through and through. It's very important to us that we made a Michigan-based company. So why the M1 agency? Well, here's the story. It started just before the pandemic, and right at the kitchen table, I watched my wife, Lisa, guide her mom, Beverly, through surgeries, hospital visits, and Medicare. And I witnessed firsthand the importance of a medical power of attorney, and thank goodness, for her dad's Social Security survivor benefits. Even with good coverage, it felt like a full-time job. And as a Gen Xer from Michigan, I just saw the need to get ahead, learn from the boomers to better serve our generation, and also wanted to give back. And through Forgotten Harvest, we do that to help with senior hunger, senior food insecurity. So we built the M1 agency. It was a way to use my experience in insurance, mortgages, and fintech to help Michiganders plan Social Security smart before Medicare decisions come into play. Now, healthcare costs, they are a major, major concern, especially in Michigan. And I hear this all the time. I thought Medicare was free. We've got 1.6 million residents that are over 65, and it's not free for any of them. In fact, on average, they spend over $6,000 a year. So I want to draw your attention, to the 202.90, the Part B base premium for 2026. It's in the right lane. That premium, okay, that's just the Part B premium. That does not include copays or coinsurance. And as a nod to my grandpa, who worked the line at GM forever, you would expect a Chevy or a Pontiac level of coverage at that base premium. And for many people, that's all they need. And we'll walk through strategies to stretch your dollar, your healthcare dollar, so you're getting the most for that premium. Now, if you're still working, this is a good chance. Review your pay stub, look at HSA deposits. You might have costs for critical illness or hospital indemnity, dental, optical. And then in addition to that, you've got copays, you've got labs, you've got all your medical bills throughout the year that add up. You might be paying for a Buick or an Olds, but again, you might still be only getting that Impala level value. Okay. Now, there's some of you in that left lane right now. You're on ACA plans. You're paying for a Cadillac, but you're getting a Yugo. Medicare actually may lower your costs. Any vehicle, any of these cars can get you where you need to go. It's really the trim package that depends on the budget. So that's where we help. Now, transitioning into Medicare, it just requires a new way of managing those healthcare costs and finances. And for many, it's the first time that you're ever paying a healthcare premium directly out of your pocket. So, we want to look at strategies. How are we going to pay for all this? And more importantly, what are the roadblocks we need to worry about when we are paying for this? Now, as far as enrollments, when you're thinking about Medicare enrollment, many of you are also seriously considering Social Security claiming. And as a registered Social Security analyst, this is a step where we help optimize timing. So you're claiming, so your benefits, taxes, Medicare premiums, they're all starting to work together and not against each other. This is a key step right here. Okay. Also, too, you want to make sure transitioning to Medicare that you've got your HIPAA and patient advocate designation in place, your medical power of attorney. In Michigan, we call them PADs. But it's a good time to just make sure all that stuff is updated and ready to go. If these aren't updated, your spouse or family member, they may not be able to speak on your behalf when it matters most. Now, there's one last part of this. There's an IRMA awareness in that lower right-hand corner. If you are a higher earner, and when we say higher earner, that only means $109,000 a month. Medicare comes with another layer. It comes with IRMA surcharges. So with that, starting at $109,000 a year rather, that can mean higher Part B and Part D premiums, that's based on what you filed for your 2024 income. And that's often, triggers things like Roth conversions, or can be triggered by things like Roth conversions, um, uh, RMDs potentially, or other poorly timed withdrawals. So again, I know it's a lot, but it's exactly why you don't want to do this alone. And you want to talk through all this stuff up front and make sure you're working with an agent who understands how all of these pieces fit together. Most retirement money, okay, that can cause these issues, it's going to live in one of three places, be it an employer plan, market account, or liquid savings. The strategy isn't where it sits, it's how it's used. And that's where, again, tools like Roth conversions, annuity backed long term care planning, it all comes into play. It's just making sure that when you're going through all this and looking at all these things, that you're using the right dollars in the right order for the right job to make sure you're not triggering those IRMA surcharges. And we don't do this alone. We partner with groups like IRMA Solutions to help us calculate those. Also, too, and that's where, again, we're going to identify those fee traps in the Medicare surcharge for your Part B and Part A and what they could look like in the future. We also partner with Trust and Will to help clients get a no-cost estate plan, if you don't have one already, in place during major life transitions. And yes, that's Matthew Stafford, love him or hate him. He does endorse them. He earned over $400 million in his career. So I think that's a pretty good endorsement. But real reason we use them, they're efficient, they're simple, they're trusted by over 1 million clients nationwide. Again, if you don't have a trust and will in place, this is really a time to do this as you're transitioning to Medicare. We offer it for free. And it's exactly really what families are looking for, when the big major changes are happening, big major life changes. Okay, so as we go through this, I just want to tackle a few myths. One that we hear all the time is that you got to pay a fee to a broker to get help with all of this. That is totally false. In fact, it'd be illegal and we would lose our license. You do not pay us a fee at all for this. So let's jump into Original Medicare. We don't have a ton of time. Want to keep it high level. We'll keep it simple, easy to understand. Starting point for Medicare, please take notes here, is Part A and Part B. And this is, it's important to understand, which each of these covers. Part A is your hospital coverage, your inpatient stays. Okay, so this is free if you or your spouse worked 10 non-consecutive years, or 40 quarters of coverage. Part B, that is your doctor, your outpatient coverage. The standard cost, again, is that $202.90 a month with no IRMA adjustments. You want to make sure to jot that number down on a cheat sheet or piece of paper, please, because that is a key number to know. Now, everyone's got a different enrollment scenario. And before we meet, you want to make sure we figure out, which one fits you best. Scenario one, easiest one. You're already on Social Security. It's really receiving benefits, already really the easiest one to get through. Scenario two, you're not receiving benefits and never made a Social Security account. A little bit more work to do there. Now, scenario three, you're still working. This is the most complicated one, and you really haven't started thinking about Medicare yet. We'll cover all these. So in scenario one, again, please make a note of that $202.90. I cannot stress that enough. Everybody pays that unless there's a special circumstance, but you're automatically going to be enrolled into Medicare. You typically receive your ID card about 3 months before your birthday. It's been taking a little bit longer than that, but there's not much to do, and it's easy to set up, your Medicare plan. Okay, now on scenario two, this is a little bit more work to do here. You'll need to set up a Social Security account online and register for Medicare Online. We highly, highly, highly recommend that. Okay. As an RSSA, we can help you, create the account, optimize your benefits. You can still enroll in person, by phone, by mail, but it's taking forever these days. At the M1 agency, we strongly recommend doing it online for speed and for ease. Okay, now scenario three, toughest one out there. It may involve some extra forms from your employer. We can talk that through when we meet. It's a very individual situation. It's not one size fits all. Some of you may already have been signed up for Part A and you only need Part B, but please make a note. If this is your scenario, you have group coverage. And also, if you have that, make sure you have that, available to you, your current group plan. That way we can also start to compare, because in some cases, if you're going to still work, we could start to compare the plans side by side and make the best call between the two. We do have people that, continue to work and then still enroll in Medicare, because really it's a better deal for them ultimately. So when does Medicare begin? For most people, it's going to start the month you turn 65. And unless your birthday is on the first of the month, in that case, Medicare starts the month before your birth month. This affects your initial enrollment period, your IEP. So it's good to know that if you are born on the first of the month. Now, what doesn't Medicare cover? And I hear this again all the time. Wait, I thought Medicare covered everything. Not quite. If you only have Part A and B, you've got some major, major blind spots. Okay. So, for example, Part A day one hospital stay, I mean, you're exposed to a $1,736 deductible. A longer stay, it equals daily copays. Part B, your annual deductible is only $283, no big deal, but there's a 20% coinsurance with that. There's no cap on that. It's a huge, huge risk. Plus, you've got up to 15% in excess charges if doctors don't accept Medicare rates. So it's not covering everything. How do we cover these blind spots? Well, that's the difference between, that's what the Medicare supplement or Medicare Advantage, that's how we, one of the two options is how we cover those blind spots. Okay. So most people, they've heard of Medicare supplements and Medicare Advantage plans. And outside of self-insuring or staying in an employer or group plan, if that's available to you, this is the way that 95% of the people, even more probably, fill those coverage gaps in Medicare. So please take some notes here. This part is important. There's really basically two different paths, okay, that you can take through Medicare, and they follow, again, a similar path. In Michigan, about 64% of the people are on the right side, the Medicare Advantage path. All right. About 39, or excuse me, that was last year, about 36% now are on Medicare supplements on the original Medicare path. Okay. There is no better or wrong option. Everyone's situation is unique. And in Metro Detroit, I like to compare this, to freeways and avenues. Think freeway more on the Medicare side, and think an avenue or a county road on the Advantage side. All right. So, really, again, there's no one size fits all coverage, and there isn't a wrong or a right. It's very, very unique and individual to your situation. All right. So Medicare supplement, we just want to start to compare these two options. Price, I mean, this is just the starting price. This is for, you're going to pay a Part B, the 202.90, no matter what. Now that's plus the supplement plan, which will be roughly $150 a month if it's a Plan G. You'll have the lowest out-of-pocket expenses, when you're seeing doctors or hospitals, and you could choose any doctor in the United States, anyone that takes Medicare with no referral. You also do have to keep in mind that you year to year, and you're selecting your own Part D plan. So the way that this all sets up, you'll have several different companies that insurance companies that are actually making up all of your coverage. Now, on the Medicare Advantage side, same $202.90 a month for your Part B, assuming no IRMA surcharge. Please write that down. But you don't have the cost for the Medicare supplement, so you're eliminating roughly a minimum of $150 in costs. All right, now the difference is there's more responsibility with this. Okay. And more responsibility to cover the blind spots, be that, co-pays, provider networks, max out-of-pockets limits, but it does come with extra benefits, which some folks really find appealing, like dental, vision, gym benefits, OT, over-the-counter benefits, things like that. Okay, so again, it just requires a little more work than the Medicare supplement side, but you do save money for doing that. So, bringing the two together, again, Medigap, Medicare supplement, those terms are interchangeable on the left. More coverage, no networks. You pick your own Part D plan. Think of it like taking the freeway, okay? On the right-hand side, Medicare Advantage plan, like the highway or a county road or avenue, specific doctors and hospitals, okay? Co-pays along the way, but it does come with extra benefits. So supplement, again, just one last simplification here. Supplement, pay more, get more coverage. Advantage, pay less, take on more responsibility. All right, so some of the major exposures to keep in mind with Medicare, no matter which Medicare path you choose, okay, you should strongly consider extra protection for cancer, heart attack, or stroke. These conditions, they always create big out-of-pocket costs, even with Medicare. Your medical care will be covered, but in Michigan, a typical senior is still going to spend about $2,300 out of pocket after a heart attack or a stroke. That doesn't, this does not include, Medicare is not going to cover lost wages if you're still working. 40% of Michigan seniors are working past age 65. A cancer diagnosis is going to be 3 times that, especially, if experimental drugs are needed, travel to specialty clinics out of state are required, or just, longer term treatment is involved. So your total exposure really depends on how much care you need and how long the treatment lasts. Now, there's another major hole to consider on Medicare, and that's skilled nursing. Okay. This is on either path, be it Medicare Supplement or Medicare Advantage. It's huge financial risk if you don't have long-term care coverage, LTC coverage, in place. In Michigan, costs can run $9,000 to $12,000 a month. And for many retirees, protecting assets is the priority. And this is an exposure you really have to take seriously here. The key takeaway that you want to write down: after day 100 on any Medicare plan, day 101, you are responsible in any cost in a skilled nursing facility. Okay, so you're responsible for the full bill. And if we go to the jump to the Medicare and You handbook, you'll see what it says about skilled nursing coverage. It breaks it down. We could show you where this is during our consultation, but you'll see on the right-hand side, on the bottom paragraph, skilled nursing, it only kicks in after a 3-day hospital stay. And even then, coverage is limited. There's no custodial coverage in a lot of cases. And because of that, at M1, we always recommend recovery care, to cover you beyond that day 100. And it really helps eliminate your biggest exposure in Medicare. Okay, so for Michiganders, as we're putting these packages together, we like to think of this umbrella coverage in lanes. So whether you choose Medicare Advantage or a Medicare Supplement as your base plan, that coverage will be similar, but the blind spots will be different. Okay, so that's why we recommend umbrella coverage around your healthcare plans, things like recovery and home care, annuity-backed long-term care, and just as important, proper estate documents like a will or trust, the HIPAA authorization, that medical power of attorney. These documents matter more than most people realize, and without them, even a spouse can hit roadblocks when decisions need to be made. So just a quick touch on it for now. We'll go deeper on this near the end, but the goal is simple. Choose the lane that helps protect you from the exposures that you don't see coming. Okay, so let's take a closer look at the Medicare Supplement. This is the plan for those that are okay with paying a bit more monthly, and in return, you're going to get the freedom to choose your doctors across the country. And if you're like me, you're not a fan of waiting in lines, think again of this as that freeway option. So we looked at these earlier. These are the major exposures of the original Medicare Parts A and B. It's important to keep these in mind as you weigh your options. Okay. So we also too just want to shift to this Medicare Supplement, the 3 parts that make it up. Now, a Medicare Supplement, also known as Medigap, please make a note of that. Those terms are interchangeable in the industry. That's going to help fill the gaps that parts A and B don't cover. And that will work with, going back to the slide, A and B plus your supplement plus your prescription drug plan. So if we're looking at these supplements in a little bit more detail, we really focus on just 2 options these days, the Plan G and the Plan N. These are really the only ones that make any financial sense these days and are widely available. Plan G, it's as simple as it gets. Your only exposure is the $283 Part B deductible. Plan N also has the $283 deductible, but you could face excess charges up to 15% more than the 20% coinsurance. Rare, but something to keep in mind. Really, the question is which one is right for you. So nobody works for free, right? This is what you hear all the time. The insurance company must charge a higher price if you're going through a broker. I want to stress this. You will pay the same no matter whether you enroll with the carrier or direct or with a broker. The carrier is required to charge the same price, no exceptions. The carrier pays us to make sure you know how your coverage works, make sure application is done right, and what to expect. In the end, what you're really shopping for is the best mix of education, choice, and expertise. Now, going to that Plan G, okay? In Michigan, we would call this the Cadillac of Medigap plans. Typically $125 to $175 per month on top of that 202, okay, the 202.90. So keep that in mind. That's when you can see those costs go up a little bit. And that's where, again, you're paying a little bit more, but you're on the freeway. There's no stops, okay? The Plan N typically is going to be still a Medigap plan. It's going to be about $20 or $30 less than the Plan G. Please note, in Michigan, there's also, especially in the UP, near the Wisconsin border, there's the Plan G high deductible that we often recommend. So if you're dead set on the Medicare supplement, but you're more budget minded, please ask us if you're up north, or excuse me, especially if you're in the UP, about the Plan G high deductible. It'll cut the premium about $100, still give you the flexibility you need. But if you're leaning towards supplement, it's typically going to be either Plan G or Plan N that are paired with umbrella coverage. All right, now, the best time to enroll, it's about 3 months prior to your Medicare start date. Okay, so basically 3 months before your birthday, your 65th birthday. It's important to note that if you're currently on an employer plan and contributing to a health savings account, 6 months prior to the date you intend to take Medicare, be sure to stop contributing to avoid tax penalties. And it'll also help you ensure ahead of time, if you're applying, that you're getting the lowest premiums and plenty of time to review, make changes if needed. And then one of the hardest parts of my job is explaining this. Medigap policies, they are standardized. Plan G is Plan G, Plan N is Plan N, no matter the company, Blue Cross, HAP, Priority, McLaren, United. You're really shopping for price, financial rating, customer service, and technology experience. Last myth here. Okay, if you are paid by the insurance companies, you must have a bias towards one company or the next. Completely false. All companies pay the same premiums. There's really no hidden advantage. Our goal at M1 is to help you find the most value for the premium you're already going to pay, no matter what. Stretch those dollars. Here's a list of the carriers we work with in Michigan. We highlighted on the right by the 9 that are based right here in Michigan. We make sure that you understand how these carriers work with your preferred health system. That's a big key of our part of our consultation. Whether it's Corewell, Trinity Health, Munson, Henry Ford, Bronson, McLaren, U of M, whoever I'm leaving out. We work with all the major carriers in Michigan that work with all these health systems, and we're continually evaluating our partnerships as the healthcare market evolves. The point is, we don't care who you choose. We have them all. We want to find the best package for you. So there's no denying it. Prescription drug coverages, it's just not a fun topic. It's complicated. It's very individualized. And because of that, I do want to explain this a little more conceptually and at a high level. Some calls when we talk prescription drugs, they're really quick, especially, when you have one prescription, there's just not much to talk through. Others, people have a dozen or 13 or 14 prescriptions. It takes a lot longer to review. So it's a great note to take here. Please start building an accurate list of your medication types and prescriptions, the prescribed amounts, because that really does help with a consultation, be it Medicare supplement or Advantage, okay? Because you're going to need a Part D either way. Sometimes that's included in that, usually included in that Advantage plan. So the prescription drug plan, the Plan D, the PDP plan, you're going to hear it called both things interchangeably. Just remember that your Part D plan is what you'll need on its own if you're going the Medicare Medigap route, the Medicare supplement route. But the Part D or PDP plan, they're interchangeable terms. You'll hear them called either way. Okay, so important to note here. If somebody doesn't have drug coverage when first eligible for Medicare, they get hit with a penalty. It's 1% extra for every month they wait. But if they have creditable coverage from work or another plan, they're in the clear, okay? And we love all Bob Probert if you're a Red Wing fan, but you don't want to spend all that time in the penalty box. Just make sure that you sign up shortly after your coverage ends. Again, we talked through that as part of the consultation. So as we're going through our Part D process, this is key. We correctly input all the drugs into Medicare's online calculator. we go through the pharmacies. Then step 3, compare all the plan options available in your zip code, enroll. But the key step is number 5, and this is what we do in the fall, is, we continually reevaluate year to year, and that's key, and that's really the point of working with an agent, is because you're always going to have to continually, your prescription drug plan is going to evolve, your prescription list is going to evolve, and we always want to continually evaluate that in the fall when the time is right to make changes. Okay, so there's 3 pieces here: Medicare, MedSup, and PDP. And then with those, all right, so that keep in mind that $202.90 for the Part B premium. The Medicare supplement's going to have a cost of roughly $125 to $175. The PDP plan typically is going to be a zero premium, but often is going to carry your copays for your prescriptions. So you're generally looking, somewhere $400 to $600 when it's all said and done with a prescription drug plan, depending on your situation. Now, Medicare Advantage plan, it's not necessarily more complicated. It just needs more planning. And remember, now we're getting off the freeway. Okay, so there's more stoplights, more pedestrians, more turns. A Medicare supplement really just requires mostly prescription planning, but with a Medicare Advantage plan, you also need to plan for doctors and specialists beyond just prescriptions. All right, so Medicare Advantage plans, they're based on your zip code. They can change from county to county. They're not as standard as Medicare supplements. They're more personalized. You can choose between HMO and PPOs. It's called managed care. The government pays a private company to take over your Medicare, very similar to a group plan that many of you are familiar with. And the setup is meant to save money and manage care locally. And I don't lean either way. My mom loves her Advantage plan, brags about it. My uncle loves his Medigap plan, wouldn't switch it. It's like telling somebody how to set up their golf bag. It's very, very personal. So these are the plans you see advertised on TV, sometimes zero premiums and depending on your income. But don't forget, you'll have to pay your Part B premium, the $202.90, no matter what, on either side. Also, too, you got to take into consideration hospital costs. So you don't pay monthly premium for Advantage plans oftentimes, but it's the hospital costs that include copays, deductibles, coinsurance, as well as max out of pockets. So that's why we always recommend umbrella coverage, especially with Advantage plans. Remember, Advantage plans, they can change every year. So reviewing them is a must in the fall. Bottom line, always, 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 always have umbrella coverage if you go the Medicare Advantage route. So how do we pick a Medicare Advantage plan? Well, think of it, there's a waterfall to it here. Each step kind of flows into the next. It's like planning a road trip to Tonquaneman Falls. So we're going up north, right? Step 1, we get in that right lane. We're just putting in our zip code. We want to see what's available. Decide also at that point, do we want an HMO, for lower cost, but a tighter network, or are we prefer a PPO, which is going to have more network flexibility and often a more budget-friendly alternative to a Medigap plan, okay? An important reminder is that Medicare Advantage is not Medigap. No Medicare Advantage plan is going to give you the same level of control as a Medigap policy. But PPO plans, they do offer more flexibility than HMOs, similar to many employer plans. Now, step 2, that's where we're moving to that middle lane, and we confirm your doctors, your hospitals, your prescriptions, make sure they're covered. This protects you from surprise bills or network issues. Now, step 3, okay, this is where we move to that fast lane and we look at the fun stuff, the extra benefits, the dental, the optical, the gym memberships, hearing tests, over-the-counter cards, things like that. The extra benefits, though, they come last. We want to make sure that the fundamentals fit first, the network, the meds, and the budget, so there are no surprises, okay? So with Medicare Advantage plans, usually, again, same kind of process. You want to start about 3 months out before you're electing coverage. Don't worry. If you don't like what you enrolled in, there's still time to make adjustments. You can, change your Medicare Advantage plan also every year during the annual enrollment period in the fall. That starts October 15th through December 7th. That's the time when you're going to see all the commercials on TV and getting just bombarded at the mailbox. I apologize for that ahead of time. So, it's time to, again, just if we got take a minute here, look at the notes, fill in some of the blanks. Again, Medicare supplement side, you're going to have a $202.90 Part B premium plus the cost of the supplement, roughly, again, $150 a month or so. You'll have the lowest out-of-pocket costs when you're seeing doctors or hospitals. Choose any network or doctor in the USA that's contracted with Medicare. No referrals needed. You do have to manage that standalone Part B policy. And on the Medicare Advantage side, again, still the 202. You don't have that supplemental premium, but you do have the 202.90. You have generally higher out-of-pocket costs when you're seeing doctors and hospitals, and you do have to work with specific doctors contracted with the plan generally, unless it's a PPO. Part D plan is not separate. It's typically going to be included in the Medicare Advantage plan. And then also too, this is where you've got the extra benefits that include dental, vision, gym, over the counter, et cetera, et cetera. So this is where it all comes together. Most people, again, they don't live in one clean lane, but this is where the lanes, they really help frame the conversation. Okay. So if you're in that passing lane, on the left-hand side, you're thinking Medigap probably. You're more sensitive generally to IRMA surcharges for your Part B, so there's little more work to do there up front. Long-term care is a real concern, and you typically need a trust-based estate plan if you don't have one already. If you're in the far right lane on the other side, the priority really is going to be stretching every single dollar. But you can't ignore the basics like a medical power of attorney, that HIPAA authorization. And the truth is, most of us though are going to fall somewhere in that middle lane. Okay, we got mixed concerns, and our job is to customize this and put it all together for your situation. It's like building a golf bag. All right, you don't need 14 drivers. You need the right club for the right shots that you're actually going to take, and that's how we figure all this out together. Okay, so we're in the home stretch here. Again, just want to recap the 3 truths of using a broker. There's no fees charged for Medicare or any senior health services. Truth 2, you pay the insurance company the same price whether you work with a broker or not. And truth 3, we've got over 20 companies to choose from. We're not biased. We want to put the best package together for your situation. So you've completed phase 1. You're now on to phase 2. Bottom line is that M1, we want to help you start getting everything together so you can figure out which lane is best for you. We don't do this once. When we're in phase 3, we don't do this once and disappear. We follow up with a cadence of check-ins throughout the year just to keep you up to date on plan changes. So when you're ready, October comes around, we'll be ready and ready to work with you for whatever, communication method fits best for you. So to wrap this all up, if you live in Michigan or you're watching this on behalf of someone that is confused about Social Security, turning 65 in the next 6 months or so, or you're getting ready to retire, please let the M1 agency be the local option you talk to before calling a paid celebrity on TV. And if the timing isn't right, please follow the M1 agency on Facebook, where you found us. We are very active also on Instagram and LinkedIn and YouTube. Please scan the QR code for my full digital business card, email, phone. It's all there. Social media links, my calendar, everything's there. So please, thank you. I want to thank you just again for spending 30 minutes with us, just over 30 minutes with us today. And we look forward to working with you. If you're ready, click the link below to schedule your consultation and to get that free will. If you're interested in that portion of it, we hope it was informative. And we truly look forward to speaking with you soon. Thank you for your time.